On Friday, 7th May 2020, the Ministry of Family and Welfare announced revised policies for the discharge of COVID-19 patients. Let me tell you the three categories. For mild, very mild, pre-symptomatic cases, admission is necessary. If 10 days after the start of the symptoms, they do not have a fever for 3 days, then without testing they can be discharged. As the guidelines, after discharge, the patients have to follow home isolation for 7 days. If their oxygen levels are above 95%, then they are healthy. If the patient's oxygen level drops below 95%, then the patient will be shifted to the COVID healthcare centers. If the oxygen levels fall below 90%, patients may have lethargy, confusion, or mental disruption. For patients admitted having moderate cases, if after 10 days of the start of symptoms, there is no fever for 3 days, and the oxygen level is above 95% for the 4 days without oxygen support, then they will be discharged. They also will be discharged without testing. They will be advised for home isolation for 7 days. If the moderate case fever does not solve, they will need oxygen support. Once they are better and oxygen levels are normal, after 3 days they will be discharged. If their levels are still low, they will be monitored and then they will be discharged after 3 days. Severe cases of COVID-19 patients who are already HIV positive or those who have undergone transplant surgery like kidney. Such patients have a weak immune system. Mild and moderate cases can be discharged. For severe cases, they need to be moderated by the doctor. Once their symptoms go away, they will not be discharged, but they will have to do the RT-PCR test.